Daron Feng, Dean of IESR, to give us an introduction.
Perfect.
Hello, Darren. Thanks for being the keynote for this conference.
Hi. Well, thank you for inviting me.
Hi. So, ladies and gentlemen, good evening and good afternoon and good morning. Welcome to the third IESR-GLO joint conference. My name is Shuaizang Feng. As the Dean of the IESR at Jinan University, I want to first welcome all of you to our webinar. It's so glad to see so many people joining the COVID-19 conference despite the COVID-19 pandemic. So I guess many of you may not have heard about IESR. So I'd like to take this opportunity also to introduce IESR, or Institute for Economics and Social Research, very briefly. Well, it may not be so brief, but it will only take 2 minutes. IESR actually is a very young institute, but has been developing very fast during the last 4 years. Founded at Jinan University in December 2015, it now has 42 faculty members working in a variety of different specialized fields in economics, such as labor, IO, trade, microeconometrics, environment, urban, macro, etc. We also have undergraduate, graduate, and PhD programs now, with our first cohort of undergraduate and master's students graduating this year, and many of them will continue the academic pursuit in major Western universities. IESR's main research focus is on China. The mission of the institute is to advance policy-oriented economic and social research by addressing present social and economic issues in China. The institute also runs a survey data center, which collects fresh new data from China and manage data sets. We also have a policy research center for policy analysis and evaluation, and the majority of our research projects and publications are also about China. IESR is one of the most international-oriented economics institutions in China, with Professor James Hickman as the chair of the advisory board. So most of our faculty members had their PhD from prestigious institutions such as Chicago, Yale, Berkeley, LSE, etc. And they are also actively involved in international collaborations. And they have published in AER, RE-STAT, AEJ, IER, JOE, JIE, and many other top international journals. IESR is very appreciative of its partnerships with many renowned international institutions, including GLO, Global Labor Organization. And this is the third time we are jointly organizing an annual workshop. This year, we are very proud to have the conference theme on COVID-19, a pressing challenge for all of us around the globe. And we have received a very large number of submissions and have selected very high quality papers to be presented in the next 3 days, starting from today. And we are also extremely honored to have Professor Daron Acemoglu from MIT and Professor Chuck Maskey from Northwestern, two most influential thinkers in our profession, as our keynote speakers. So thank you once again for participating in the conference. I hope some of you will visit us in Guangzhou after the pandemic, if the flight resumes. If you allow, I will now invite Professor Klaus Zimmermann, the president of GLO, to say a few words about GLO, and also to introduce our keynote speaker today, Professor Daron Acemoglu, more formally. Thank you.
Thank you very much for having me, Shuaizang. Also from my side, it's a pleasure to have this joint collaboration again and the ongoing relationship. I will make it brief. We want to hear what Daron has to say. Well, let me first say that the GLO, the Global Labor Organization, is an organization of scientists engaging in global networking and believing in the benefits of collaborations and evidence-based policymaking, things which are not nationally accepted again around the world. We are now about 1,700 individuals in over 130 countries at universities and research centers. And globalization is under threat since quite a while, and that's why we were created in 2017. And COVID-19 is just another, but very ultimate threat on globalization. So it's clear that we as an organization must deal with it as many others. And this is also why we are here now in this collaboration. Global collaborations are needed to defeat this crisis. This is very important, and that's why we do all this. This is why I'm now formally happy to announce Daron Acemoglu of MIT. It's very difficult to introduce him, first because he has endlessly published in journals and in books, and second, it's because all of you know him very well. So anyway, his work covers broad areas of our discipline, including political economy, economic development, economic growth, and of course also labor economics. And he likes to focus key, broad, general issues like why nations fail, something which might become a new meaning in these days. Yes, he wrote about the origins of power, poverty, and prosperity. And he also has a recent book on the economic origins of dictatorship and democracy. And also democracy is an issue which is becoming very relevant also in the context of COVID-19. And last but not least, he is one of the best published economists of our time. And that's why we all, of course, expect in such a situation leadership from people, and he is one of the global leaders in our discipline, and that's why it's quite natural to have him here now at this critical stage. And well, it's not surprising that he talks in a moment about optimally targeted lockdown, because I guess as we see, many people are now obsessed about maximizing or minimizing, yes, risks, or minimizing risk or maximizing chances or whatever. Economists typically do not like about minimizing or maximizing. We like to optimize, and that's why lockdowns might be a very valuable instrument to deal with the crisis. We have to optimally target lockdowns, and that's why we should listen to what he has to say. And I would have hoped you would have had all his modeling earlier in this disease to get a better reaction to what we are doing, and but it's still not too late, and we have to learn for many other reasons. So Daron, let me give you the floor now, and to give us some ideas how one should deal with such a challenge.
Thank you, Klaes, and thank you, Shuajiang, for the event way for the invitation. It's a great pleasure to be here. This is a great event, and the fact that you have brought together hundreds of people from all around the world for this important event, and the fact that GLO and IERS are both involved, that makes it definitely a good venue. As Klaus said, I worked on many fields, but I'm always a labor economist at heart. So it's great to be here. Let me start with some general comments, and then I'll jump into this. And I think the general comments are both for setting the scene and also for expressing why I think such collaborations are very important. You know, I think there is little doubt in my mind that we are going through one of the most defining crises of the last 80 years, if not the most dangerous. And there are many aspects in which our institutions have failed. But there is one dimension in which I have been really heartened. It's the only silver lining in all of these terrible performances in everything else, and that's the global academic collaboration. You know, the fact that it's a real global effort to find the vaccine with the Chinese scientists publishing the RNA in January, the best practices that have evolved, and for those countries at least who are learning, and now academics from every discipline bringing their expertise to help us cope better with this crisis. I think it's really the only, in my opinion, heartening aspect of this crisis, especially in economics. I've been really pleased to see, literally hundreds of economists, young and old, jump into into an unknown area, because this is really a super important challenge, and people have done an excellent job of really investigating various different aspects. And that's essentially what myself and my colleagues, Viktor Chernozukov, Ivan Werning, and Mike Winston, have also tried to do. And in particular, there are many different aspects of the epidemic that can be investigated, but I think one of the most important ones, at least in our opinion, was to think beyond the 0-1 lockdowns. You either lock down or you don't lock down, because I think that sort of reasoning was the one that led to lots of grim choices, and sometimes, in some sense, perhaps even suboptimal choices around the world. And we wanted to contribute to that. And it is normal that people have first thought about the epidemiological aspects, herd immunity, mitigation, vaccine timing, but also as soon as you start thinking about COVID, economic costs of lockdowns are relevant, and that's what economists have started bringing to the table. But, not sufficiently emphasized in the policy analysis early on, even though this was very much stressed by many people on the ground, or as also incorporated in models like Ferguson, in terms of the realistic calibrations, is that the mortality rates from the disease, conditional on infection, are highly asymmetric. As some medical professionals have characterized, COVID-19 is like two diseases. One is like a flu, the other one is a deadly disease. And in particular, it tends to be a deadly disease for people with comorbidities, and especially those with that are over 65. So if you compare, for example, over 65 mortality rate, conditional on infection, it's about 60 times as much as the mortality rate of those between 20 and 49. And that includes, within the 20 and 49 group, those with severe comorbidities in the US, such as obesity, heart problems, asthma. So if you take those out, it's really several orders of magnitude different between the older and the younger groups. So this really calls for a rethink of how we should design lockdowns. And that brings both practical and theoretical conceptual issues, and that's what we try to tackle. So we try to develop a framework for doing this. In particular, it involves something that epidemiologists have done already, which is introduce a multi-group model of an SIR. So we do that slightly differently, but very much in line with the epidemiological framework. But then we bring optimal policy analysis into this framework. So in other words, it's a multi-group SIR or SEIR model. We're going to limit the analysis for clarity, and that's, as I'm going to show you, actually, you get a lot of gains by doing this already. Just 3 groups: young, middle-aged, and old. Of course, once you buy into the framework, it's pretty straightforward to do more groups, also distinguish people by comorbidities. But we're just going to stick for now with these 3 groups, and then calibrate it to the COVID-19 pandemic, and then compare optimal controls under different scenarios. Let me give you a couple of the main findings. I think the most important finding, which is summarized in this figure, is that the trade-off facing policymakers is hugely improved by looking at targeted lockdowns. I'll give you the numbers as not now to save time, and but I'll go through them in detail in a second. But one way of thinking of these trade-offs just qualitatively is in terms of the Pareto frontier between to two things that we care about: deaths and economic loss. The origin here is the best place to be. No excess deaths from the pandemic and no economic loss from the pandemic. And of course, we are very far from that. The black frontier is the one where you limit yourself to what essentially almost all governments have done, which is non-targeted or uniform lockdown policies. So our main result is that quantitatively and qualitatively, you get very different effects when you allow targeted lockdown. So that's the dashed line there. And moreover, and this is one perhaps surprising feature, is going to be how large the gains are going to be. And I'll explain quantitatively what they are and why we get such large gains. A second aspect, actually, I just realized I haven't maximized this. So let me actually maximize my screen, so that might make it better. Okay. Okay. All right. I'm having a hard time maximizing. All right. Let me not try to do that. Okay. Okay, now I can do it. Sorry. Full screen mode. Okay. But the second surprising feature here is, in some sense, that most of the gains, and by this, overwhelming amount of gains, as I will show you, can be obtained in a very simple way. You don't need to have very complicated policies that treats different age groups very differently, despite the fact that there's an order of magnitude difference between the mortality conditional on infection of the young and the middle-aged, those between 50 and 65. If you treat them the same, and if you just adopt policies that are more protective of the over 65 group, the most vulnerable group, you achieve almost all of the gains. And protecting the most vulnerable is not in itself enough, and it doesn't say, oh, then you can go ahead and open the economy and the rest can socially interact, because there are spillovers between the two groups, even when there is lockdown policy. And then I'll show some other stuff about testing, group distancing, and various other network properties of the model. Of course, some caveats. We are not epidemiologists, and epidemiologists have their own way of thinking about the problem that's very useful. Sometimes the two groups can interact in productive ways, and we hope this is part of that. And there is a huge amount of uncertainty about model parameters. Chuck Munsky is going to talk about that, I presume. And optimums, I'll show you, actually said, if I have time, are very sensitive to some parameters. So that's a real problem. And I would have preferred that some of the early works on this, like Ferguson's report, had more humility, because these things are really sensitive to parameters on which we are very uncertain. But one thing I'm going to show you is very, very robust, is that the quantitatively large gains of semi-targeted or targeted policies relative to non-targeted policies are very robust. All right, this is the plan. I'll talk about the model. I'll do that in about 10-15 minutes. Calibration, I'll show you the parameters very quickly, and then I'll spend the remaining 10 minutes or so on the model, on the main results and robustness. So this is our model. We call this a multi-group or multi-risk SIR model. Multi-group is one of the terms epidemiologists use also. And this is one way of summarizing our model. If you take the top part of this, that would be similar to an extended version, a slight extension of the standard SIR model. People are susceptible. They can become infected. If they become infected, they may have a severe or mild infection, that's whether it requires ICU or not. And then out of that, they either become recovered or they die. Now, we do this for multiple groups. Different groups have their own transitions. And importantly, the orange shows the network of contacts between different groups. And we're going to use throughout the same notation as the standard epidemiological models: S for susceptible, I for infected, R for recovered, and D for deaths, and the total population is constant. And then when we have exposed non-infectious people, we use the term AE, but I'm not going to show you those results. In the standard SIR model, new infections are a quadratic function of susceptible people and infected people who infect them. The quadratic search technology is just like in the coconut model of Diamond, but it's actually not completely uncontroversial even within epidemiology. So we'll actually show you results with generalized matching function. All right, very quickly, we have J groups in practice, and when you come to calibration, 3 groups. Once you're infected, a fraction ij or iota j is severe for group J. That's higher for the older people, for example. 1 minus iota j is not severe. All infections resolve at the rate gamma j. Now, you might want to have other resolutions, and in general, we allow for those, which is exposed, non-infectious, and then ICU states, etc. I'm not going to get into that. All of the mild recover, but the ones who are having a severe infection, they may die. So the delta J is the probability that they die. Delta JR is the probability that they recover. Delta JD, the death probability for this group, we allow it to depend in over capacity in the ICU in the hospital sector. That's actually turns out to be very important. It was a very important factor in Italy, and also to some degree in some of the local area hospitals in Boston and New York as well. We set up the model with testing and isolation. Even though testing is still very limited in the US, very sad situation. This is important both to understand what testing achieves, but even without testing, there is isolation, because especially if you are in ICU or sometimes who are mild, there is isolation. So eta j here, let me not get into how tau j and phi j come in, but eta j is the total probability that an individual is not isolated. And you can be isolated for a variety of reasons, either because you're tested or because you're in an ICU or other things. And then another parameter that's important, how to be important, is what is the likelihood that people who are recovered can be recognized as recovered without, say, antibody testing that's accurate and sent back to work, even if there is some partial lockdown. That we capture with kappa j. Now, this is the most important slide to understand what's going to come. We're going to look at lockdowns, LJ, or LJT, because it's a function of time and different for different groups. And there are 2 constraints on the lockdown. One is that there are some essential workers, so you may want to keep lockdown below some L bar J. But second, even if you lock down people, they are not going to fully obey it. For voluntary or involuntary reasons, they're still going to engage in other interactions, and we capture that with this theta j. So fraction of interactions among the infected is going to be 1 minus theta j LJT. So for example, if LJ was 1, 1 minus theta j would be those who really escape the lockdown or who engage in social activities or perhaps even get it through non-personal contacts. And then there is also going to be an opportunity cost WJ, which can be endogenized, but I'll take it as exogenous right now, which is the economic opportunity cost, the wage income if you are out, or it might also include other economic contributions that you make if you're out of a lockdown. The time of arrival of cure and vaccine is uncertain, but we're going to assume it comes at some time t. You can make that stochastic, it doesn't really matter. And then in the baseline, we'll take that to be 1.5 years. All right. So this is the model. Now, the key equation at the bottom shows you how some of those parameters come in. In particular, let me emphasize that we have this 1 minus theta j LJ and 1 minus theta k LK coming in a quadratic form. Why? Because 1 minus theta j LJ SJ are those who are susceptible in group J who are not in effective lockdown, but then they interact with people who are not in effective lockdown in the other group. And then the rho JK is the interaction probability, so how likely you are to interact with different age groups during normal time. And then the eta K is the isolation rate of different groups. And of course, IK is the infected. And then the sum that you're taking here is across different groups, because you can be infected by individuals in different groups, infected individuals. So we're gonna draw Pareto frontiers, as I said, and they have two objectives: lives lost, that's the non-pecuniary value of life, and economic losses. Economic losses already includes losses from death, because if somebody dies unnecessarily from the pandemic, their future economic contributions are taken out. So this psi j incorporates those things. In addition, it incorporates all of the losses due to the susceptible people being under lockdown with probability with wage wj. But then we also allow some of those people, or all of them, depending in different calibrations, to have productivity at home. All of us now are at home and are engaged in productive interactions. That's psi j. Okay, the rest is let me not get into that. But the fact that economic losses are here is the reason why this Pareto frontier is upward sloping here. In particular, if you do not protect people and many of them die, you enter into the upward sloping part where you're losing both lives and economic output. Okay. All right. The last theoretical idea I want to talk about is herd immunity. In the case of a single group SIR, herd immunity is a region where you enter, and once you enter that region, there aren't enough susceptible people that infections don't spread. Now, in a multi-group setting, the herd immunity region is an area, not a point or not an interval. And in the two-group case, for example, it looks something like this. We always start the dynamics here, around somewhere here. Nobody, very few people, most people are susceptible. And then we move somewhere. But different lockdown, if there's no lockdown, we would move like the 45-degree. Different lockdown policies make this rate different, and they take us to different parts of the herd immunity space. If you're moving very slow, by the time the vaccine comes, you hit, you're not in the herd immunity region. So that's like a waiting for the vaccine strategy. I'll show that quantitatively. But herd immunity would be before the vaccine comes, you enter into this green area. But even if you decide to go for herd immunity, targeting would be super important, because the social costs of entering here versus here are going to be very different. All right. Are there any questions, or we'll take the questions at the end? Okay. All right. So since time is short, let me not spend much time on the parameters. We take parameters mostly standard from Ferguson, South Korean data. We target an R0 of 2.4. We take the duration of the disease to be 18 days to include the ICU period. That doesn't really matter. And then I'm going to start with a uniform matching pattern between different groups, and I'll show you what happens when you include more realistic asymmetric heterogeneity. The only other thing that I want to talk about is that because in the US we're calibrating many of the economic and socio-demographic parameters to the US, the over 65s work much less. We match their average earnings, which is about 1/4 of the middle-aged. And then we allow for this overcapacity to matter. That's actually not unimportant. And that for the baseline, let me start with kappa j. And then the other important parameter that we choose is the theta j. We choose it as 0.75. So that means that if you lock down everything fully, that will still lead 1 out of every 4 people to be outside and interact with others and infect others. And the essential workers, we assume that 30% of young and middle age are essential, and none of the over 65s are essential. All right. All right, let me show you the results. So the first result is that we construct the empirical versions of the frontiers that I showed you at the beginning. And for the parameters that I outlined. And this is it. So the red one is the frontier when you have uniform policies. On the horizontal axis, rather than total number of deaths, I'm showing you the fatalities as a fraction of the adult population. And here I'm showing you the PDV of an economic loss as a fraction of 1 year's GDP. So the red line, at least under the parameters for the US, where there are a lot of comorbidities, high mortality rates, and very low testing and isolation, the choices are really grim. So you see things like economic losses equivalent to 40% of 1 year's GDP, and fatality rates that could be as high as 1% of the adult population. So those are really grim choices. Now, by changing parameters, for example, if individuals wear face masks so that the R0, the initial reproduction rate, is brought down, some of those can be improved, but we did not do that for the baseline. So the most important thing is that if you now look at the semi-targeted policy, which is the one that just treats the older group differently, that's this green frontier. That's already quite a bit better. So you hardly ever get to things like 40% GDP, and you hardly ever get to levels like 1% mortality in that case. So semi-targeted, so even a minimal amount of targeting gets you a huge deal. And I'm going to try to explain why that is in a second. But the second point that I want to make is already apparent. The blue frontier is the one when you do full targeting. You target the three groups very differently. And it's essentially on top of the green one. You see it's a little bit below the green one. Theoretically, it cannot be above the green one, but it's not perceptibly different. So almost all of the gains you get with semi-targeting. So let me now explain what this frontier corresponds to and why you're getting these gains. So to do that, let me pick a point on the frontier. So this dot here, which I'm going to call a safety-focused policy, which says mortality rate should never exceed 0.2% of the adult population. Or you can pick a point like this, which says, I don't want the economic losses. We cannot withstand economic losses exceeding 10%. Like that might be true in some developing economies, for example. So here is the uniform policies that you would get if that's the objective. So up here, we are seeing the lockdown, that lockdown policy that's uniform, that applies to all groups when you have the safety-focused objective. So this is going to be a pretty severe lockdown. You see that the lockdown lasts for almost a year and a half. And for quite a bit of the time, you have more than 40% of the economy under lockdown. But as a result, you can keep the fatalities relatively low. And the way that you do that is by keeping the infection rates low. But the economic cost of this, as the frontier already showed, is quite high. You get more than 38% loss as equivalent to 1 year's GDP loss. One other feature here, two other features here are important. One is that in this case, the infection rates for the three groups are identical because we've assumed that the only heterogeneity between the three groups is in their mortality. In practice, there is some evidence that even infection rates could be different, but it seems that the evidence there is not completely clear, so we didn't do that. So in that case, because all groups are interacting in a symmetric way, they're all getting the same infection. But of course, if you look at the mortality, the deaths, they come predominantly from the older group. The second important feature is this uptick in the infections towards the end. Why is that? Well, because towards the end, as you can see here, you're releasing people from the lockdown knowing that the vaccine is coming. So before 2 months before the vaccine is going to be marketed, everybody's going to know, or 3 months or 4 months. And when that's the case, when you know the vaccine is coming, it's okay to allow the infections to pick up a little bit. But the reason why the infections are picking up is because there is no herd immunity. This is a telltale sign of no herd immunity, because if there was herd immunity when you let people come out of the lockdown, the number of susceptible would be low enough that you wouldn't get this. Now let's look at the bottom. In the bottom, you're looking at the economy-focused policy. It's a much shorter lockdown, so the infections peak much greater. But as a result, you are going to get, 1 second. I'm giving a talk, please. Sorry. So with this much higher rate of infections, you build herd immunity. And how do you see the herd immunity being built up? Now, before the vaccine, people are completely out of a lockdown, but there is no uptick in infections. But the cost of this herd immunity, of course, is much higher rates of mortality, slightly above 1% of the adult population. That's very, very costly. Now, the same thing, but okay, let me just skip that. Now let's look at semi-targeted policy. Here we have the safety focused, and below is the economy focused. Again, the 2 points on the frontier that I picked. You see several major differences. First, the optimal lockdown for the old, shown in this dashed line, is keep them in lockdown all the way until the vaccine comes. And because the old, the most vulnerable group, is under lockdown, now you can release the young from the, or the younger groups, the middle age and the young, from lockdown much sooner. But you don't release them immediately. Why not? Because if you release them immediately, even though the old are under lockdown, they're still interacting with the young through social contacts, through deliveries, and various other people who don't obey the lockdown. That theta, 1 minus theta being quarter, would still lead to very high mortality among the old. So the main reason why you're doing the lockdown on the young is, again, to protect the old, but you don't need to do it as much. So you release them, and as a result, now you get a double whammy. You improve both economic outcomes, because the young are out of the lockdown quite quickly relative to the uniform case. And of course, you get much better public health outcomes because the most vulnerable group is protected. Under the safety focused case, you can see the uptick here again. Why? Because even with this policy, with this additional tool, you're still not going for herd immunity when you really want to protect the population. But now the situation is very different under the economy focused policy. It's even a shorter lockdown now, but very importantly, this still leads to a high peak of infections for the young. As a result, you're very rapidly going through the herd immunity part, but not along the 45-degree line as I showed you, but for one that infects the young much harder. But once you come into the herd immunity region, now you can let the old come out of lockdown as well. So the old here come out of lockdown in about 14 months. In both cases, the quantitative gains are very large. So for example, in the case of safety-focused ones, you can reduce the economic costs by more than 12%. In the case of economy-focused ones, you can reduce fatalities by almost 0.6%, huge numbers. Now, what happens if you did full targeting? You would not treat the young and the middle-aged the same, so we characterize the full optimal policy, but the quantitative gains are very small, as this one showed. And the reason for that is because you really don't get much or lose much out of the mortality of the young or the middle-aged because it's so low. The reason why you're keeping them in lockdown is to protect the old, and for that, the two groups are interchangeable. Okay. All right. You could go even for lower mortality rates. For example, instead of 0.2, you could go 0.05. The economic cost would be higher, but semi-targeting again helps similarly. Now, one question you might have is whether these optimal policies are locking down the old because the old contribute less economically or because they're more vulnerable to the infection. So here we separate the old into two groups, the old retired and the old working, and we assume the old working have exactly the same productivity as the middle-aged and the young. And these figures show that the main, almost predominant reason you're locking down the old is not the economics, but it's the asymmetry in their infections. So in particular, under the safety-focused one, you lock down both the old retired and the old working because they both have similar high vulnerability to the infection. Under the economy first one, you release the old working a little bit before than the old retired, but that's about it. Let me skip this. I want to just do a couple of other things and then conclude. One is that this structure with multiple groups also introduces other policies, and one that we think is very important is group distancing, which means, you know, you don't let young relatives visit nursing homes, and you try to minimize contact between, say, the older, more vulnerable group and the younger, more infected group in supermarkets. So we call that group distancing. And what this figure shows is that if you do group distancing, you can get much, much higher gains from targeted policies because group distancing and targeting are actually complements. Testing and contact tracing, those actually, of course, they're very effective as in any other model. But again, they work together with targeted policies, and you can do much better in that case. In particular, what we show is that if you combine group distancing and some moderate amount of testing and tracing, then you can actually let the young out of a lockdown immediately. Because under testing and tracing and group distancing, the young don't really infect the old. And once that's the case, there is no reason for keeping the young under lockdown. So the final thing that I want to do is we do a lot of robustness checks. In all cases, the results are very robust. But one that's interesting is that we use the BBC pandemic project data on interactions between different groups. So we allow the raw parameters, which is the likelihood of interaction between different groups, to differ. And those are the results in this case shown here. This is the matrix of interactions. These are the Pareto frontiers. There's a slightly larger difference between targeted, fully targeted and semi-targeted policy. But the broader conclusions, even the quantitative numbers, are the same, with one important difference. When you take these realistic interaction matrices, you see something that, of course, everybody knew. The old interact more with the old. Most people have friends and social acquaintances in their age group. So this raw numbers have larger, this matrix has larger diagonal elements. When that's the case, you get a non-monotonic pattern for the lockdown of the old. Why is that? Well, because once the young infection rates decline, and you know that the old are actually not interacting with the young very much, you start releasing them. But when you release them, even though they're not interacting much with the young, they're still interacting. So the infections start building up within that group. But the group is interacting a lot with itself. So once the infections start increasing, you need to lock them again. And that's this non-monotonic pattern. All right, let me stop there by making two final comments. First of all, this is very much, we hope this is part of a research agenda that others will work on. I think there's much to gain from combining epidemiology and economics, and I think these are the good times for it. So I welcome questions, and I welcome people wanting to engage more with these issues. And in the spirit of that, and in the spirit of the global open science, we also have an interactive GUI for this. The website where you can reach it is down here, and it looks like this. You can change the parameters and compute the optimal policies yourself if you are interested. Thank you very much, and I'll stop sharing now, and we can take questions and comments. Thank you.
Thanks, Daron, for the talk. The talk has shown how to design better targeted lockdown policies, and so with this smart lockdown policy, we can save more lives at the same economic cost. I read one famous textbook by Daron, the Introduction to Modern Economic Growth. So I think this paper might be a basis for a new chapter for that book. So we have a few minutes for Q&A. So if you have questions, you can directly ask, or you can raise hand and I will unmute you. So there's one question in the Q&A bar by Xi. So the question is on the first figure in the presentation. Let me see. So it's on the output loss with no control, with the output loss with maximum control. And in that figure, the output loss with no control is lower than the output loss with maximum control. So the question is, if we extend the time horizon, and if we delay the arrival of herd immunity, will the loss from no control be larger than the loss from maximum control?
There is no, it's a good question. There is no theoretical reason for the no control output loss to be less. So in particular, if the mortality of no control is high enough, and the people who die are young aged, so therefore they would have had a very, very long time to make economic contributions, then the no control losses would increase and they could become larger than the maximal control. So the maximal control, you know what it is. In our model, you have 1.5 years of 1.5 years of time until the vaccine comes. The maximal lockdown is 0.7. So that's really 1 year's GDP essentially. So that's the maximal lockdown. So the question is, if you do nothing, will more people die than say something like 10% of the population? And if those are, you know, people who have more than 10 years of contribution, then you would, the no control would exceed the maximal control.
I see. So there's another question in the chat box. So how big is the calibrated interaction parameter, and how does between generation interaction parameters affect these results?
Right, thank you very much. So, so in the baseline, we take the interaction parameter rho to be the same across all groups. And unfortunately, the way that all of these models work, nobody yet knows. Well, this is not the model, sorry, I should have said the reality. I mean, the reality, the epidemiology, nobody knows yet what's the probability of infection conditional on contact. So if Klaus is susceptible and I'm infected and we shake hands, what's the probability that Klaus gets infected? Nobody knows that. So then in all of these models, what you calibrate is the product of me and Klaus interacting times a conditional on that interaction and infection happening. And then you calibrate that to R0, which is like 2.4. Although in China, early on, there were numbers greater than 2.4, but those probably were not accurate. So, but then when we come to the later results, as I showed you, what we do is that we reduce that rho parameter for between group interactions, and the between group interactions are about 30% or so lower than the within group interactions.
Klaus, you have a question?
Yes, can you hear me?
Mm-hmm. Yes.
Okay, now this is all about disease, yes, but we are talking about a pandemic. Let's assume I'm Australia. Why isn't the best policy just to close down all airports and protect the borders, so to speak?
Fantastic question. So absolutely, you're 100% right. Once we understand how the right model for a closed economy, I think we need to do the open economy. And the open economy problem is very complicated because the timing of infections in different countries are different. So that is one of the reasons why policies like the ones that were advocated by Ferguson et al. Are very misguided. So in other words, they were policies that involve very strict lockdowns, then open up, and then very strict lockdown. Those are the ones that would both leave you very susceptible when people come into your country, and also because you're regenerating the disease in your country, you would create huge negative externalities on other countries. I think I cannot tell you how bad those policies are really in some sense. And they were completely caused, I had a figure on that, they are completely caused by the fact that they weren't actually using an optimal control type thing. So if you do optimal control, you never get those really strict, very strict lockdown and then cut it off and then do it again, even under various different types of constraints. You may get some slight non-monotonicity. But I think once we go to this international setting, you also need to consider other tools, just like you suggested, Klaus, which is, it's not just lockdowns, but what do we do for people who come across the border? Now, for airports, fine. Even that's not easy, right? You know, even if you say people who come through the airports, they're going to be in a 2-week lockdown, how do we get them to their houses? So there are lots of logistical issues as well as other problems, but all of those need to be tackled. So it's like in the climate change, you know, the first generation models of climate change, they were for a closed economy. They were hard enough, but in the second generation, where many economies interacting and not taking into account the externalities they create on others. So that needs to be done. By the way, I just one other thing I should say about international interactions. Once you take the international interactions into account, herd immunity starts becoming more attractive. Because from your selfish point of view, herd immunity protects you from the negative effect of other countries. You create a negative effect on other countries, but you don't take that into account. So herd immunity starts becoming much more attractive. So the Sweden, as a small open economy, I think there are many reasons why ex post people are going to say, actually, Sweden wasn't so wrong.
Thanks. We have time for one last question.
Can I ask a question?
Please.
Hi, Daron. First, thank you for agreeing on, participating in this conference. Is there any implication of your model in terms of like unemployment among different groups? I see you consider the loss in GDPs. How about the unemployment? I'm sure there are some heterogeneities across different groups.
Perfect. Yeah. Yeah, that's a great question. So this class of models can be extended in many directions, and I think a very important but difficult one is to introduce both sectoral structure and non-competitive labor market. So in particular, low-skilled workers, minorities, work predominantly in the hospitality sector. That's the one that's going to be closed down for a variety of reasons, both voluntary social distancing and policy. And the economic losses are therefore going to concentrate on that group. That then creates a lot of other social problems, provided that any redistributive tools are imperfect. So some European governments have done very well in terms of tackling the fiscal problem. I mean, expanding their fiscal capacity spending to deal with the problem. But in everywhere, the losses from the pandemic are very unequally distributed. Actually, the lockdown losses are very unequally distributed as well. We do that in the paper. I didn't get into it. There are groups that can work from home. There are groups who cannot work from home. There are children who go to schools that are high quality enough that they can do Zoom teaching. But my guess is that over 60% of US middle school and elementary school students are learning nothing at the moment, because they were already in troubled schools, and it was very hard for teachers to deal in the classroom and doing it via Zoom, and especially with limited bandwidth for many of them. I think it's just very, very difficult. So there are many, many inequality implications of both the pandemic spreading and the lockdowns here.
Thank you.
Okay. Thanks, Daron, again for the talk. And we really hope that you can visit us.
Wait, I think there are people raising hand.
I can take one more question if there is time.
Yeah, so there's a question in the chat box. So interactions between groups. So maybe I will unmute Daniel, and you can directly ask.
Hi, Daniela.
Can you hear me?
Yes.
Okay, perfect. Thank you. You already touched the case of Sweden, where I live. And I think that the setting is like this. We never have close freedom for the group younger than 16. But the initial condition related to the interaction between the groups, which I really like to have an answer to you about modeling, is the fact that many people in Sweden, which actually is making also the difference between old age and risk groups, these risk groups people, which are, it's happened that most of them are old age, live in two kinds of settings. One is institutional with long-term care, and the other one is at home. And both these groups, which actually most of them are at risk, they're in touch with personnel, which is actually low educated, and also some of them didn't and don't know Swedish enough. And my question to you, and I didn't say thank you for your presentation and excellent model, it's about how a model could take in consideration this interaction between groups, because we are assuming a lot of protection. And already both Swedish epidemiologists and politicians recognized that one of the mistakes was ignoring this aspect related to both education and protection of people who actually need to be in contact with people at risk.
You're 100%, yeah, you're 100% right. That's true in Sweden. It's actually true in the US and the UK as well. In the US, between 40 to 50% of deaths so far have been in nursing homes. It's a huge number. And the nursing home problems is exactly that the nursing home employees were not protected enough. They were working in many jobs. Some of them were working in the hospitality sector at the same time. So that nursing homes need to be treated separately. This is one place where, for example, testing could be super useful. So I think one extension of the model, which we did not do, is actually separate the nursing home yet as another group. So because they have different structure of interactions. So for their theta J could be different than the theta J. But on the other hand, I must also say that another big assumption is that, you know, again, for the US and Sweden, that's not a big thing, but for developing countries, you know, there are many, many multi-generation households, and separating differential lockdowns become much more challenging in that case. So those are also need to be taken into account.
Thank you. By the way, now a short, only to have a little bit flavor about this. Actually, in Sweden was offered the possibility for this nucleus family with many generations living in a very, very small area to apply for a new residency. And actually, very few were applying. Thank you. I will not. Only that you have an idea. Thank you.
I know. Yes, thank you.
Thanks, Daniela. So we are just on time, 11 o'clock. So thanks, Daron, for taking the time for doing the talk. Thank you very much. And,
thanks a lot. Bye-bye. Thank you, everybody.